Aloha! Welcome to our Facebook Live today. We'd just like to welcome you here and thank you for joining me. My name is Dr. Catherine Taketa-Wong. I'm a naturopathic physician and acupuncturist. And for those of you who aren't familiar with naturopathic physicians like medical doctors, we have to attend a four-year medical school. We are trained as primary care physicians, and as such, I can order lab tests, write prescriptions, do school physicals, and other things just like other doctors. But a big difference is that with naturopathic medicine, naturopathic physicians are trained in the power of nutrition to build health from the inside. I use personalized food recommendations as well as vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. Before we begin, I just wanted to let you know that if you have health concerns that you would like to talk with me about, we offer a no-charge phone consultation called the Personal Health Strategy Session. The 15-minute strategy session is where you can talk with me personally about your condition, and we come up with a plan to see how I can help you the most. So arranging a consultation is very easy. Just call our office at 808-425-2987 and let our staff know that you're interested in a no-charge phone consultation. So today's event is focused on digestion, and we're going to be talking about natural treatment for things that are common but not necessarily normal. So common symptoms that we see, especially in American society, things like gas, bloating, heartburn, constipation, loose stools or diarrhea, and more. So healthy digestion is really important. It's the foundation of our well-being. So this Facebook Live event is really important for everyone. So let's get started, and please feel free to use the comment section to ask questions as the talk progresses. So what I'm about to share with you is information that you will rarely ever hear from your conventional medical doctor, and it's hard to find. There is all kinds of information that you will find on the internet. Some of it is reliable, some of it not so much. So I'm going to give you today the inside scoop. I'm going to take you behind the curtain and reveal what's really going on inside the body and how to treat these conditions naturally. And when it comes to digestive issues in America, what's common is not necessarily normal. So, for example, people joke about it, but when someone is passing gas all the time, it's often a sign that there's something that they're eating that they're not digesting well. And people joke about it and everything, but it's common, but it's not normal for that to happen. And it could also be due to food allergies or sensitivities or not having enough digestive enzymes, which is no laughing matter. So we'll get more into all of these different kind of things. So the first one that I'm going to talk about is one that is embarrassing sometimes for people to talk about, but we're going to talk about gas. And again, like I mentioned, it's something that people will often joke about, and they are talking with friends or, other kinds of things, because of course it's very embarrassing when you have, when you have gas or these other kinds of things. And why does the body make gas in the first place? Most people have no idea. So I'm just going to explain a little bit about that. So gas is made in our body, in our digestive system, when we're fermenting or breaking down our food. So if you think about, like, if you have food that's sitting on the counter and that maybe you forgot about that, and then it just sits there, and then it's like a covered container. You might find that after it's been sitting out, like if you forgot about it for a day or something like that, and it's a plastic cover, you may find that the plastic cover starts to like balloon out. Or if it was covered by like plastic wrap or something that's somewhat flexible, then the cover may have expanded a little bit, might be rounded, because basically when food is fermenting, there's more gas that's being produced by that food in the fermentation process. So it's normal to have small amounts of gas that are produced, because as our body breaks down food, there is a certain amount of time, of course, from the time we eat our food until the stuff that we don't need comes out on the other end, as things that our body doesn't need. So in that process of breaking down our food, there is some fermentation that happens of the food, and it's normal to have small amounts of gas occasionally, but not all the time. And also, if you have gas that's really foul smelling, like it clears the whole room kind of thing, that is also not normal. It's common in America, but it's not normal, because it's normal to have small amounts of gas that may not have very much of a smell. But if you're constantly passing gas all the time, that's really, really smelly, clear the room kind of thing, then that's not normal. So that's a sign that there's something that you're eating that you're not digesting well. And what happens is if your body has difficulty digesting certain foods, then what happens is that it can take a longer period of time to break that food down. And sometimes that food may be sitting for a longer period of time in the intestines. And so it's sitting, it's fermenting longer and longer. And if you've ever forgotten about a container of food in a backpack or something and then found it a week later or something, you know that it's really smelly, right? Because it's been fermenting for a while, and it stinks because in that process there's bacteria that starts to grow, and the bacteria breaks down the food and they produce gas, but it'll start to smell. And so if you have really foul smelling gas, that's a sign that there's something that you're not digesting well, because it's taking a longer period of time for your body to break it down. It's sitting in the digestive tract for a longer period of time, and then as a result you're having really stinky gas that's coming out. There also may be problems with your body's ability to move the food along at a normal pace. So if you are taking drugs like opiates, like morphine, or Vicodin, or other kinds of drugs, will slow down the movement of the food along the intestines. So if you have problems, there are other medical conditions that can also slow down the movement of the food along the intestines. And I'll get more into those a little bit later when we talk about constipation. But if you are taking medications or have conditions that are slowing down the movement of the food, it's going to take longer, and that food can be sitting for a longer period of time and then fermenting, and can lead to really smelly gas. So also your body needs adequate amounts of digestive enzymes and stomach acid and other kinds of things to break down the food. So sometimes if people are not making enough stomach acid, or if they're not making enough of the digestive enzymes, that can also be a cause of really smelly gas, or a lot of gas, because they're not making enough of the enzymes to break those foods down. And as a result, the body has a much harder time breaking those foods down. It takes longer. Food is sitting longer, fermenting in the intestines. And then as a result, again, you have some of the smelly gas. Some people also have bloating, where their belly feels really distended and it feels really uncomfortable, and you can feel like you have gas in there, and it feels like you need to pass gas, but it just won't come out. And so that's another manifestation of gas, which we call bloating. But it's basically gas that is building up inside, and for whatever reason, it's not coming out. That can actually sometimes be more problematic than gas that is coming out, because if the gas sits there, then that can really start to cause a lot of pain, a lot of discomfort, and can cause other kinds of issues if there are certain types of gases that are being produced in higher than normal amounts. So there's another condition called SIBO, or small intestinal bacterial overgrowth, where if people are having really significant amounts of gas or bloating, that could be something to look at. We'll touch on that more later. So now I'm going to move on to heartburn. So heartburn is especially common in the United States. You see evidence of that by seeing all these Zantac and Pepcid AC commercials online and everything, where they have different advertisements. Someone's eating a hot dog and drinking a soda, and then they take their Zantac, or they take their Pepsid or omeprazole or whatever else they're taking, and then, oh, they have instant relief. And then it's like, oh, okay, well, then I can go and then I can eat this hot dog and drink this soda and it's fine. So the thing is, though, that people often don't realize that there actually are problems with a lot of the acid blocking medications. So, acid blocker prescriptions are really, really common in the United States. Um, so heartburn is common, but it's not normal at all. Acid reflux or heartburn is really a sign, again, that there is typically something that you're not digesting well. And I will say this is one thing that most people do not realize is that most people who have acid reflux or heartburn, most people are not actually overproducing acid. They're not typically making too much acid. So that is very, very rarely the cause of the problem. Sometimes that can be the problem, but majority of people do not have problems with overproduction of acid. The issue is that there typically is some type of food, again, that they're not digesting well. And if you're not able to digest and break down the food well, then it can reflux back up. And then that can manifest as pain. Heartburn typically manifests as a burning type of sensation in either the throat or the chest. It can also feel like you're regurgitating some food up. Your throat can tend to feel dry or coughing. People can have a dry cough. And there are some people who have acid reflux or heartburn where they don't have any of the burning kind of symptoms or the pain in their throat or in their chest. And all they have, their only manifestation is a dry cough, and that's it. And there are, of course, many things that can cause a dry cough. So you do need to do an adequate workup to make sure that that's the cause. But there are definitely a number of patients, like I said, that I've seen that can actually have issues with acid reflux, and their only manifestation is dry cough. So just keep that in mind. So some of the things, like I mentioned, with acid reflux, um, again, people not digesting food well, um, but there could also be physical problems. There's something called a hiatal hernia where the stomach, so just a quick anatomy lesson, there's your throat or your esophagus that kind of comes down over here, and then it connects with the stomach. So you have this esophagus or your throat, it's like a tube, and then you have the stomach over here. And there's a muscle, a sphincter, that sits on top that basically the muscle like closes and opens. And what happens is that that muscle, after you swallow food, it's supposed to close so that basically you have the food that stays in the stomach and it doesn't go back up the esophagus or the throat. So sometimes what happens is there can be physical problems where the stomach literally comes up through the top of the stomach, comes up through the top of that sphincter and is actually poking up into above the sphincter. And then as a result, the sphincter isn't able to completely close, and then people can have acid reflux. So there are physical problems like that. Which can be addressed through different kinds of things. There are manual methods of pulling the stomach down to help address hiatal hernias. And sometimes it's addressed in the most extreme cases with surgery. But those are some of the things that that can be an issue. So again, there are certain foods that can trigger reflux in a lot of people. Primarily those are greasy foods, spicy foods, fried foods. There are also more acidic foods, things like acid, that are high in acid, like citrus fruits or tomatoes, that those can be common triggers of reflux as well in people. So, but again, the majority of the time, it's not actually an overproduction of acid. It's usually, more often, it's usually some kind of problem with a certain food. So what I typically do when I have patients that come in that are dealing with chronic heartburn is that I'll test them for food allergies or food sensitivities. We may test to see if they're making enough of digestive enzymes to help them break down the food. And another thing that's important is testing levels of stomach acid sometimes because, as I mentioned, most people are not actually overproducing acid. And there are some people that actually have acid reflux that are actually having issues with making not enough stomach acid. And that's actually a reason that they're having the heartburn. So stomach acid, we hear so many things about acid blockers and that, you want to, acid blockers, there are basically drugs that decrease your stomach's production of acid. One of the important things, though, is that you actually need your stomach acid to be able to properly digest your food and break it down. You also need your stomach acid to be able to absorb a lot of important vitamins and minerals. So we actually need our stomach acid to be able to absorb minerals like calcium, magnesium, zinc, iron, and then also vitamin B12. Some of the B vitamins are really important to be able to absorb because they can affect brain function, they can affect energy, they can affect neurological or nerve function. And if we're not absorbing these nutrients, that can be a problem. And guess what? If you're not making enough stomach acid, then that can cause multiple problems. It can cause problems with your body's ability to break down the foods in the first place. And so, as I mentioned, some people actually have problems with acid reflux or heartburn because they're not making enough stomach acid. And then as a result, because they can't break down their food well, then the food is not being digested well, and then it refluxes back up into the throat. So that can definitely be an issue. But some of the problems with some of these drugs, like Prilosec or Prevacid or Nexium, is that they will decrease, of course, your stomach acid. And so that can lead to, if someone is actually underproducing, if they're not making enough stomach acid in the first place, an acid blocker might temporarily reduce the problem or the symptoms because they don't have any acid to come back up. But in the long run, it could actually make the problem worse. And as I mentioned, you need your stomach acid to absorb a lot of important minerals and vitamins. And if you're taking these acid blockers long term, you can actually be more at risk for getting deficient in these vitamins. Calcium is one that, of course, we know if there are problems that they found that long-term or high-dose use of PPIs or proton pump inhibitors, which are acid-blocking drugs, can actually increase the risk of bone fractures. And it can actually cause problems, too, with more risk of getting food poisoning. Another reason that we have stomach acid is that acid is very strong and it will kill a lot of bacteria. But if you don't have enough of that stomach acid, if you're taking these drugs for a long period of time, then what happens is you may not have enough stomach acid to kill bacteria, bad bacteria that may be present in food. And as a result, you could be more at risk for actually having food poisoning or other infections in the stomach. So that's another concern. There are also some types of heartburn drugs that have been associated with an increased risk for heart attack. So that's another thing to really look at. So there are also other concerns with acid blocking drugs, but I've just covered some of the main ones. So again, you really want to focus on avoiding, if you are suffering from acid reflux, you want to first avoid those common trigger foods that are associated with reflux, which again, as I mentioned, typically includes spicy or greasy or fatty or acidic foods. Alcohol is another really common trigger. For some people, things like coffee or chocolate or onions can also be triggers. And then also avoiding overeating because a heavy meal can trigger reflux, especially if you eat late at night and then you lie down right after. because what can happen is if you've just eaten food and then you lie down right after and your body doesn't have enough time to digest the food and get it down, then it's more likely for the food to come back up the esophagus. So that's something that you want to pay attention to, is not eating late at night. And then there are a number of other things that are used naturally to try to address these kinds of issues. So again, like I mentioned, I will test your food allergies or sensitivities. I'll work on changing people's diets, avoiding those sensitivities. Digestive enzymes can be very helpful in testing for stomach acid. So again, just to let you know, we will be wrapping up after we cover a few other topics. And I wanted to remind you that we do offer a no-charge phone consultation if you want to talk with me personally about any health concerns that you have. So again, arranging a consultation is easy. Just call our office, 808-425-2987, and let our staff know that you're interested in a no-charge phone consultation. I'm going to move on to a couple of other topics. So one is constipation, and then the next one is loose stools or diarrhea. So constipation. First of all, I just want to address what is constipation in the first place, because there are some people who, or there are many of us who aren't really aware of what exactly qualifies as constipation. So the definition that I use and that most holistic health practitioners use is that to not be constipated, you should be having a normal soft bowel movement, which is soft and formed at least once a day. So anything outside of that, basically where if you are not going at least once a day, so if you're going less frequently, if you're going every other day, then most conventional medical doctors would say, oh, that's no problem. But for me, I consider that constipation because it is really important that we're eliminating every day. So you should be going at least once a day. And then another thing is that your stool should be soft and formed. Some people get kind of grossed out when I talk about poop, but I tell people that your poop really should be kind of like a sausage. It should be soft and formed. It shouldn't be lumpy or hard, and it also should have some form to it. We don't want it to be too loose, and I'll get to the other extreme later on, but we don't want it to be too loose where it's falling apart in the bowl or it's mushy or it's liquidy, because that can be a problem as well. So and so I do tell people, again, at least one bowel movement every day. And you don't have to necessarily go 3 times a day. That's certainly better if you're avoiding more often, like going 2 or 3 times a day. But at least once a day is the minimum that I like to see. So another issue that could be a sign of constipation is if you're having very small amounts of stools. So maybe you have a bowel movement every day, but it's just really, really small amounts, just like a few pebbles, and then that's it. And there's no, it's just a very small amount. If you're eating a normal amount of food, unless you're fasting, then that can be normal. But if you're eating a normal amount of food for most adults, then you really should have, a bowel movement that's more significant than that, usually maybe about that long or so. It shouldn't just be small little pieces and then that's it. You should have a sense that everything has come out, because some people do have a sense that they feel like there's still poop inside and it hasn't quite all come out. So that can be another manifestation of constipation if you're feeling internally like there's still poop in there that just didn't get out. And another symptom can be when you're really having trouble getting it out, really straining to go. Most of the time that tends to happen if the stool is really hard. But there are some people that are straining a lot and have a really hard time passing stool that is even soft. So that's rarer, but that can happen. So why does constipation happen? There are a lot of different causes. I would say for most Americans, the problem usually is issues like, poor diet, not enough water. So as a basis, you do want to make sure that you're drinking enough water. Um, there are some medical conditions where there's limitations on water intake, like congestive heart failure or kidney failure, but most people don't have limitations on how much water they can drink. So usually this is a rough guideline. Again, it doesn't apply to everyone, but a rough guideline I give is taking your body weight in pounds and then taking about half of that, and then that's about how many ounces of water you should drink. So for example, someone's 100 pounds, then they should ideally be drinking about 50 ounces of water a day. So again, doesn't apply to everyone, but that's a rough guideline that can be used for most people. Another problem in most Americans' diet is that they're not getting enough fiber. So fiber is really important because it acts like a stimulant in our body to help to help your intestines move the food along. So if you're eating fast food all the time, hamburgers and soda, and you're probably not getting enough fiber. Where we get a lot of fiber, primarily from fresh fruits and vegetables, also whole grains, and then also things like beans or lentils, legumes are really high in fiber. So what you want to try to do is try to get your food as least processed as possible. So you're going to get more fiber if you, for example, are eating an apple rather than drinking apple juice, because apple juice takes out most of the fiber. So fresh fruits, eating a good amount of fresh fruits and vegetables, whole grains. And when I say whole grains, I'm not talking about like Wheaties cereal. I'm talking about where you can actually see the whole grain. And so that would be things like quinoa or brown rice or whole wheat, buckwheat, where you can actually see the whole grain, where it's not processed or broken down. So those are the best forms of grains if you're getting fiber through that. And then, as I mentioned, beans and lentils are actually very, very high in fiber. So those are excellent foods to add to make sure that you're getting enough fiber in your diet. Also, being very sedentary or not moving around much can be a cause of constipation. A lot of Americans are sitting every day, the whole day at desk jobs, not moving around very much. And when you move around, then that physically gets circulation and it actually massages the intestines and helps physically to move the stool along. So, making sure that you're getting enough movement and exercise, even if it's just walking up the stairs or parking farther and then walking to your car, things like that. But the more movement, the more steps that you can get in, that will definitely help in terms of constipation. And there can be other things. There are certain medications like opioids, narcotics, antidepressants, iron pills can also cause constipation. There are certain antacids that can cause constipation, but there can also be a number of other things. There's irritable bowel syndrome, where people may be having constipation or sometimes alternating loose stool and constipation. Typically, irritable bowel syndrome, there's also either some abdominal pain or a lot of gas or bloating, and we'll touch a little bit more on that next time too. But there can also be problems with low thyroid function, which is called hypothyroid. And the thyroid gland is responsible for metabolism, which is kind of like, you could think of it like a fire that's fueling your whole body. So if you think about like a campfire where the fire is just almost gone out, you can see that there's not very much fuel, of course, there. And that's essentially what's happening to the body in hypothyroidism, is that there's not enough power, so to speak, to generate the energy to move food along the intestines. And so as a result, you can have you can have low energy, and you can also have constipation. There are other symptoms, but doctors can check for low thyroid function. There are other conditions that are not as common. but sometimes neurological issues like Parkinson's or multiple sclerosis can also cause issues with constipation. Colon cancer can be a problem, and that can cause constipation. Other things that I'll look for, though, that's not very well known, there's something called mitochondrial dysfunction. And the mitochondria are like the batteries that power all the cells in our body. And this is pretty common among people where they might feel tired a lot, or especially if they feel like they have poor coordination or low muscle tone, or if they fatigue easily or can't keep up with other people. I see that sometimes in children, where children tend to have lower energy, or they have low muscle tone, and they have trouble keeping up with their peers in terms of physical activity, and they may also be constipated. So that's something that I test for as well. And that can be treated with a lot of different nutrients. So nutrients like CoQ10 and ribose and some other things can be very helpful for treating mitochondrial dysfunction. And again, with constipation, we really want to try to get to the underlying cause. That's where we want to do a very thorough and appropriate medical history to figure out, okay, what are the symptoms that people are having? What are other things that could be going on? Because for most of the medical conditions that I mentioned, there are other symptoms besides just constipation. So we look for clues for that. I will also do a physical exam for patients and look for clues for causes of the constipation. And I will also do lab tests typically to look for the underlying causes of these things so that we can identify and treat the underlying cause. But just some simple things, if there's not, just some of the basics, you do want to make sure, again, like you're drinking enough water, eating enough fiber, exercising or moving around, not ignoring the urge to poop. Like if you have to, like just listening to your body and going. And of course, as I mentioned, really looking back at a lot of the different kinds of things that we can do to figure out what is the underlying cause for you. Because like I said, most of these can be treated naturally, and we'll look at, treating the underlying cause for these. And then the last thing I wanted to talk about are loose stools or diarrhea. So sometimes people can have the opposite problem of constipation, where they're having loose stools. Their stools are not formed, where it's soft and falling apart, or even where it's mushy or liquidy. And of course, you can get diarrhea from things like food poisoning, things like that, different kinds of infections. If you're traveling, traveler's diarrhea. But what I'm going to talk about is more issues when people have chronic or ongoing loose stools, where it's not just like a one-time thing where they have food poisoning or they're traveling or something like that. But when they're, at home living their normal life and they're just having loose stools all the time or diarrhea all the time. Now, if you're eating a lot of fruits and vegetables, that can loosen up your stool for sure. And so you may want to look at that. I mean, because it's good to get a lot of fruits and vegetables. But typically, if you're eating a lot of fruits and vegetables, it may just cause stool that's kind of softer than normal, but typically not completely diarrhea where it's mushy and has no form at all. So when people are having issues with ongoing loose stools, then I will typically, again, do different kinds of tests. So I will look at for food allergies or sensitivities, because that's a common issue that I see where people are having problems with loose stools. There can also be issues with parasites. And people think about parasites typically where someone goes to a third world country and then they get a parasite, and that is common, but it's also much more common in the United States than most conventional medical doctors realize. And because parasites can be passed or transmitted, if someone has a parasite, for example, someone who's preparing food at a restaurant, and if they have a parasite and they don't wash their hands well after using the bathroom and they prepare food, eggs from that parasite can go into the food. And when people ingest those, then they can also get a parasite with that. Also here in Hawaii, hiking or swimming in freshwater streams, that there are certain parasites and other kinds of things that will, that will live there. And that if people swallow the water while they're swimming or things like that, then they can also get parasites from that. I actually had a patient that had been suffering with diarrhea for about 1.5 years. And she told her primary care doctor, but doctor never did any tests or anything. And so when she came in, then I tested her for parasites, and we tested for other kinds of things as well. But her diarrhea had started shortly after she had gone hiking and swimming in the mountains here, and then the diarrhea started after that. So we actually found that she actually had a parasite that is endemic to Hawaii, and you can get from swimming in freshwater streams. And so we treated her for the parasite, and then she came back and said, "Oh my gosh, I'm normal again." And I just couldn't believe that nobody had ever tested her for that. But parasites are much more common than people realize here in the United States. So it is something to stay aware of. There are also a number of other diseases of the digestive tract that can cause loose stool or diarrhea. So, for example, some of that, so for example, there are diseases like ulcerative colitis or Crohn's disease, which are problems where there's a lot of inflammation in the digestive tract, which can happen anywhere. For Crohn's disease, there's typically ulcers and other problems that can happen anywhere from the throat all the way down to the stomach, the intestines. And that typically causes a lot of other symptoms as well, just besides loose stool, but those can be causes of that. There's also celiac disease, where people have problems with gluten, gluten is a component that's in certain grains, wheat, rye, barley, contain gluten naturally. So there can also be problems with your body making enough of the bile acids, or not absorbing the bile acids well, because bile acids are needed to digest fats and break down fats. So if you find that you're getting loose stools every time you eat something that has oil or fat, even if it's a healthy fat like avocado or olive oil, things like that, where you get loose stools after you eat fatty foods, then it could be a problem with making enough of the bile acids. And that can be treated. There are over-the-counter bile acids that you could take orally. I always have people do testing though before, because you really want to make sure that you're treating and testing for the right thing, and then treating it appropriately. So other kinds of causes that can happen. So chronic pancreatitis, or inflammation of the pancreas, where the pancreas is not making enough of the digestive enzymes, because the pancreas is an organ on the left side of our abdomen that is responsible for making digestive enzymes. And if you have problems with it not being able to make enough of the enzymes, then that can cause loose stools, because your body's not able to properly digest the food, and it's just kind of going through undigested. There can also be overactive thyroid, or hyperthyroidism, where the body is basically moving the stool along the intestines too quickly before the body really has time to digest it, and then you get loose stools as a result of that. And there's also conditions like cystic fibrosis that can cause chronic loose stools. And then there's something called SIBO, or small intestinal bacterial overgrowth. Um, and so again, we want to really test appropriately, and that's where it's really important to have a healthcare practitioner who's going to take a very thorough history, who's going to look at all the symptoms that you're dealing with, and then put it together in the most likely outcome that could be going on. But especially if you've had loose stools that have been going on for a long time, and you've had all kinds of tests, even seeing a gastroenterologist, which is a doctor who specializes in digestive conditions, and you haven't gotten any answers, then definitely looking into some other things can be helpful. So among the things that I mentioned, things that are often overlooked or not adequately tested for, even by conventional gastroenterologists, are things like food sensitivities or even food allergies. I have seen patients who've gone to gastroenterologists and they were never tested for food allergies and sensitivities. So that's something that I will always, pretty much always look at. Having an adequate test for parasites. If you've been tested for parasites, you need to have at least 3 stool samples because doing fewer than that is not really adequate. And then also SIBO, so small intestinal bacterial overgrowth, is something that is not very well known among even a lot of conventional medical doctors. And that's one thing that I wanted to mention, is that especially if you're having a lot of different symptoms all together, constipation and loose stools where they're alternating, or if you're having gas, bloating, abdominal pain, if you have a diagnosis of irritable bowel syndrome but nothing's helping you get better and you haven't been tested for SIBO, then you should really look into that. So SIBO again stands for small intestinal bacterial overgrowth, or SIBO. And what is happening in that case is that there's an overgrowth of the normal bacteria in the small intestine, and that can cause a lot of digestive problems. So that includes, again, constipation, loose stool, gas, bloating, abdominal pain. And that's something that's often overlooked. And it's tested by a breath test where you drink a solution of lactulose typically, or glucose, and then you breathe into these tubes and they take a breath sample. So that's something that's really important to be screened for if you haven't been screened for. And then also checking for food allergies, sensitivities, parasites, or not making enough digestive enzymes. So those are common things that are often overlooked by many conventional medical doctors. So again, this has been just an overview. We can't touch on every possibility, but I appreciate you joining us, and thank you for being here. And I appreciate the opportunity to just let you know how important digestion is to our health and offer some tips for making positive changes with natural medicine. So again, if you have health concerns that you'd like to talk with me about, just call our office to arrange a no-charge phone consultation. And our office number, again, you'll find it on our Facebook page, but it's 808-425-2987. And we thank you for being here, and we'll see you in 2 weeks. Aloha.